questions. So I'm going to direct a question to Tushar that has come up in the chat about soy. And there were questions raised about harms to the soil, thyroid, and based on the research you've done and that's posted on Plant-Based Diet, I know you can give us a robust answer to whether there are harms of soy to the environment and soil, as well as human health.
Yeah, so basically I could start to say that if you grow anything in the world and 8 billion people, or pretty soon 10 billion people, are going to consume whatever we grow, there are going to be ecological impacts of everything. But soy actually has the lowest impact of almost any protein that we can produce, because it takes the least amount of land, probably amongst the least amount of water, not probably, but I think it takes amongst the least amount of water. It's the easiest and cheapest to grow organic and veganic, actually. It, being a lentil, it brings its own nitrogen from the air into the soil, so it benefits the soil by reducing fertilizer use and everything like that. Soy is bad for the environment because most of soy that is like 70 to 80% of soy that's grown around the world is used for animal feed. So the vast majority of soy is used for animal feed. And as we mentioned, this is inefficient. It uses more land to grow animals. So in that sense, it is not good for the environment. And most of the GMO, heavily pesticided, soy and other foods are going to be animal feed. So when we stop consuming, let's say, dairy milk and other sources or other animal foods, we will vastly use less farmland, which can then be returned to nature and rewilded. So soy consumption, the second most use, is for biofuels. Again, those things are really bad. People sell them as an ecological solution, but they're very bad for the environment, bad for food security, bad for the global poor. But soy consumption directly for humans in the form of soy protein, let's say just eating soybeans like edamame or soy milk or tofu and those kind of things, that is very, very efficient and very, very ecological, having amongst the lowest impact of anything that we can eat, with a lot of very strong health benefits too. So it depends what you're using the soy for. If you're using it for animal feed, biofuels, bad. Human consumption, good. When it comes to thyroid, there's a lot of misinformation. There's one study that in a test tube, there was some adverse effect to some thyroid cells by adding huge amounts of isoflavones or something like that. That's a test tube study. But as physicians, we know that we need human studies, clinical studies, studies that show what food actually does, or a medication or a treatment actually does in real human beings. The few studies that we have regarding soy and thyroid show that people actually have slightly lower rates of chronic hypothyroidism, maybe about 25% less. That's not a very big, serious thing because we have easy thyroid replacement. But actually, overall, the evidence shows that soy consumption benefits the thyroid. But the misinformation that goes out there always scares people that it's showing harm based on this test tube study. And as such, there's animal studies that feed rats really, really high amounts of isoflavones and shows that they have higher rates of breast cancer. And so the animal agriculture industry uses this kind of a study to scare people and then promote this message that goes viral everywhere that soy is bad for breast cancer. But the human studies, of which there are more and better studies than this single couple of rat studies, those are the ones that we really need to pay attention to. And those consistently show that there is less breast cancer in terms of primary prevention, and also at least 3 studies showing secondary prevention, so that soy consumers after a breast cancer diagnosis have slightly better outcomes.
I've also read, Tushar, that people need to consume adequate iodine, and that will help with thyroid health. So some of what might be attributed, and maybe Asha, you have also heard about this in your practice. You want to go ahead with that?
Yeah, I definitely wanted to. A couple of years ago, Dr. Weiss and we started testing our patients on, doing the 24-hour urine test. And that's when we started seeing, because at our practice, we also do no added salt. So that was like many have that, they get the iodine. And yes, you were absolutely right. And we started asking our patients, once we do that test, we will ask them to have nori or maybe a supplement, either whichever way they are going. We're not too much encouraging about the added salt, but if people want to go with that, it's okay. You know, it's totally a personal journey. So yeah.
I mean, I personally advocate for iodized salt. Friends and family ask me about Himalayan, and I'm just like, well, I'm not really sure what the evidence is there, but I would say iodized salt is a way to very easily get your iodine, though we don't encourage excessive salt consumption. There's lots of harms of that.
Yeah, I think the supplement has helped all our patients because we do that. So Gina, just to kind of, because our patients don't do added salt, so it helps them with the supplement and the nori. Those have been a big success in our practice. We've seen a big rise.
And these are really good points. Like if we are consuming salt, it should be limited, and it should be in the form of iodized salt, right? That's in North America and India, where law says that commercially available salt, most of it should be iodized. There might be some special varieties that are non-iodized, and that's a problem. Also, people who consume very low or no added salt are at risk of iodine deficiency, so a supplement is in order. When we look at Europe, places like the UK do not have iodized salt. Some other countries too. They put iodine in the dairy milk. So in those places, the soy milk and plant-based milks, etc., should be iodized, or those people they would have to find somewhere an iodized salt, because most of the salt over there is not iodized. And also in the UK, they have a veg supplement called Veg One available, made by the Vegan Society. And because it's made in the UK, it contains iodine, because again, over there, if you're switching to plant-based milk, a lot of times it may not be fortified with iodine, so they put that in the supplement, and there's some complexities around that. But yeah, definitely, we should make sure about iodine. In North America, India, it's going to come through salt or supplement, basically.
There were also some questions about ensuring enough omega-3s and vitamin K in the diet, and I will share the slide that I had in my presentation about sources of omega-3 or omega-3 precursor. Vitamin K has a couple of different forms. One form is very available in dark green leafy vegetables, which are also a great source of calcium, specifically like kale and collard greens and mustard greens. There's another form, I believe it's K2, that's important for bone health. I don't know, Asha or Tushar, if you have experience with that particular micronutrient.
I think there's no.
You're right. Sorry, you're right. At our practice, we rely a lot on the dark leaf green vegetables. We definitely have that as a big. And I know the nutrient is important, but I think a big part in our practice is we are big 50% exercise, 50% food kind of a. So we know that we have to impact that jumps, those yoga poses. You know, our patients are encouraged to focus on exercise, because that's another way. So, you know, it's all integrated, but yeah, those would be my comments.
Tushar? I don't know if it's on my end, but Tushar's video just froze, so I'm not sure if he's having a tech challenge. I think he might have just lost connection for a moment. Okay, so there's also questions about fortification process. How to ensure that it excludes animal products, and it really does vary by region. So I think we have to do our research, whether we're in India, North America, Europe, etc. Sometimes there's labeling. We can advocate for more labeling. Tushar, you're back. Okay, so I don't know if you had anything more to say about vitamin K or ensuring that fortification process excludes animal products, which is the next topic that I pulled from our chat.
So regarding vitamin K1 and K2, this is just something that is promoted by the animal agriculture industry that tries to create scaremongering amongst people who are going to eat more plant-based. There's no real evidence, I think, that K1 is any less good than K2 or anything like that, right? But in terms of fractures and bone health for vegans, there is some evidence, and this is very important, that vegans have higher rates of hip fractures. Now, this comes from data in 2 studies. Hip fractures are very devastating. They can result in death and disability and whatnot. So this is an important consequence of bone health. And what the data really shows is that people who are very underweight, especially in mainly females, so females who are very slim and are vegan, have higher rates of fractures compared to omnivores. Now, probably the biggest factor here is being underweight, but also there are some women probably who consume too less protein, and maybe are too much underweight. So those are things we need to be careful about. You know, being too much underweight, especially for women, that's where the problem lies in the data, and consuming enough protein, as well as calcium and all these things, and probably vitamin D consumption is going to be important in there too. Getting enough sunlight, and definitely doing exercise, as I think Gina and Asha both mentioned, that exercise and weight-bearing exercise is extremely important. So it doesn't necessarily mean that veganism is better for everything across the board automatically. We have to make sure we do it in the proper way. And this is going to be one thing that we really look out for. And that's why the fortified soy milk is really important for the protein and everything like that, the protein and calcium. In terms of the fortification and supplements, vitamin D and omega-3s, as Gina already mentioned, are the main ones that will come from animal sources commonly, and that there are good vegan alternatives available exactly from like what Gina's slide mentioned.
I would just add about what I'm aware of regarding the increased fractures found in studies like Epic Oxford, that it was specifically linked to less than, I think it was 350 milligrams of calcium consumption per day. So what I tell my parents, my mom who has osteoporosis, my friends, myself, I have as a consequence of being tested as a resident for a new bone scan machine, I know that I have risk for osteoporosis. Intentionally eat dark green leafy vegetables that are high in calcium, such as mustard greens, calcium. Do weight-bearing exercise like Asha mentioned, yoga poses or specific yoga for osteoporosis. Get enough vitamin D, check your levels, supplement properly, and it's not just about that bone density score. There's also something called bone quality. There's also maintaining one's balance. There's a holistic approach to preventing osteoporosis, as in all aspects of health, and it's not about drinking milk. In fact, you know, there are also observational studies linking milk consumption to fractures. So the answer is not drinking milk. The answer is really understanding all the factors that would prevent and reverse if you have already osteopenia or osteoporosis.
And I'm just going to add to that list.
I just wanted to add, Gina and Tushar, at our practice, we encourage minimum, especially if somebody is diagnosed with osteopenia, at least minimum 60 grams of proteins. And as a lifestyle coach, that's the area where we kind of then start honing in. We encourage our patients to kind of create food log. It's an ongoing process. It's not like, you know, because you would have to see your patterns and how, and yes, many of the leafy vegetables, we use those for upping their calcium intake because it's very easy. It's more absorbable. That's the beauty.
And I see
you're saying, Asha. I was going to support what you're saying, Asha, that there's evidence that a gram of protein per kilogram of body weight is probably a good idea. Yeah. Mainly, maybe more towards your ideal body weight. So it's going to be more if you're too skinny, and maybe less if you're overweight or obese. And so getting enough protein is really important, and the calcium, as you mentioned, as well. And yeah.
And
people often in the plant-based world underestimate. People often in the plant-based world say that, oh, protein is no big deal. Protein is no big deal. That's not quite true. That's an oversimplification. There are people who consume vastly too much protein, but there's a lot of people who underconsume as well. And so we have to find where we are on that spectrum and go accordingly.
Absolutely. And early on, people used to cite, based on lab rat data, that those who consume the most meat have the most fractures, and therefore it's excess protein that's the issue. And since then, we don't trust that data. And it is now important to acknowledge that the right amount of protein is helpful. And we can't dismiss these concerns. We want to be healthy for ourselves and to advocate for the things that are important. And so totally agree. Now, we have a few minutes left, and some of the other questions that we have are really important, and they kind of actually start to blend into the advocacy panel that will happen after the keynote, and probably also Ruchika Chitrabhanu will address some of this. I'll just name a couple things here about lifestyle, how to convince family to give up dairy, and family members who say sadhus and sadhvis consume dairy. I think Tushar addressed the expense of soy and its current form and what we can advocate for to make it more accessible. People are asking for recipes. We do have some resources. And they were asking about the dairy myth in India, how that originated. And I might wait until we hear from Ruchika and the final panel, because that I think might be something worth exploring at the end. There's an interesting thought here of making Jain centers lifestyle and wellness centers in addition to spiritual centers. So the question was how to discuss how we can develop each Jain center to be the resource center for their local community to learn and practice plant-based Jain lifestyle. And I do recall in the Jain Center of Northern California, there were several health fairs that included talks by people like Dr. Michael Clapper, who was then in Northern California, as well as, animal rights advocates like Will Tuttle. And they had, health screenings, and it was like part of what that Jain Center did. I'm exploring that in the Jain Center of New Jersey. Let's see what is possible. I think it's been hard and what continues to be challenging with COVID times. But I'd like to hear Tushar and Asha, your thoughts on this vision, which is promising to me.
Yeah, I definitely would support it. Because we, as you know, Gina, coming to Ethos, we are like, we have the farm base, we have the farm, and we have the medical practice, so it's a very nice merge that we have at Ethos. So no, I would support, if it happens in New Jersey, I would definitely want to support and participate in. Yep.
I just want to answer a couple of, I think it's a great idea too. I don't think, I mean, the more, it's just excellent, but I'm going to ask you a couple of questions in the chat. When somebody asked, is there evidence that you can overconsume soy? And I think if you're, consuming enormous amounts of protein, then that's, far more than, let's say, 2 grams of protein per kilogram per day or whatever like that, then yeah, you can cut back on your protein intake of soy and other sources too. I don't think it's possible to overconsume soy if you're getting sort of just a good normal amount of protein. But what I would encourage is variety. So if somebody's just eating soy all the time, I think it's better to have a variety of protein sources. So get soy in the form of soy milk. I tell my family drink 3 glasses a day at least, and you can have soy from other foods too, no problem. But make sure you're getting other sources of protein, because there's lots of beans and lentils and nuts and seeds, and all of these things are good for us. So we want to get a variety as well. So that's good. In terms of,
I just want to say, sorry, I just want to say we're kind of at time for this session.
Oh, okay.
We did want to have a 5-minute break, but I will just add to what you said, in that we are blessed to have the Indian cuisine, variety of pulses and legumes. So yes, soy is an amazing and important source of protein, and we have chana and mug and all manner of other high protein sources, in addition to what's available to us in North America and Europe, in terms of nut products and other things. So variety is important. And with that, yeah.
Just on the environmental, I'm so sorry. On the environmental front, I know I'm sort of going over here, but I also want to emphasize realistically, when we're talking about environmental issues, this is critical that, plant-based and vegan diets are definitely very, very, very important, okay? But that does not substitute the decrease in consumption in other areas of our life. It's not like we can go vegan and then just say, okay, now I can fly around and have a big house and drive a big car and all that kind of stuff, even if it's an electric car. And that holistic total decrease in consumption that Gina was mentioning is going to be really critical. And I think that's something that often happens in the vegan space, that people want to consume a lot of stuff and say, I'm vegan, so it's okay. But we want to get away from that. That's important to avoid that, that type of thinking. Sorry, Gina,
we have to be truthful. Yeah, we have to be truthful and have integrity, right? So I think that's important.